Do you guys even know where chemotherapy agents come from? If not, then you're going to want to watch this. You guys, my name is Dr. C. I'm a holistic pharmacist and educational wellness expert for Beyond Health International. You guys, today I just wanted to kind of rant while I'm driving about chemotherapy. Now, during World War I, they introduced mustard gas, okay? Mustard gas is something called sulfur mustard. It's a chemical agent that they used, and tons of soldiers were exposed to it, developed severe suppression of bone marrow, which is tissue where blood cells are made. Doctors and scientists observed this, and they observed that mustard gas killed or destroyed rapidly dividing cells, including the white blood cells. So, transition to the 1940s. So in the 1940s, researchers began investigating what's called nitrogen mustard. Nitrogen mustard, it's a chemical cousin to the mustard gas that was used in World War I, and they used this as a treatment for cancers of the blood. Now, experiments showed that it could shrink these lymphomas by targeting the fast-dividing malignant white blood cells. Now, the first chemotherapy that was actually derived is called mustine, which, again, this is directly derived from that nitrogen mustard. And it was first successfully used in about 1942 on patients with advanced lymphoma at Yale University. So I believe it was Dr. Goodman and Dr. Gilman successfully used that. Okay, and this paved the way for the field of systemic chemotherapy, where drugs circulate in the bloodstream to kill cancer cells. And again, if you ask me, I will never use chemotherapy. Straight up, just like I'll never use mustard gas. Straight. So people often ask me, if you had cancer, being a holistic pharmacist and knowing lots and lots about research and all sorts of holistic things, what would you do? So here's my scientific-backed, most effective foods, habits, and strategies that I would do for lowering my cancer risk based on the latest research. If I were to pick a diet, it would be the Mediterranean diet, okay? It's a diet that's rich in whole grains. It's a diet rich in vegetables. It's a diet rich in fruits, legumes, nuts, olive oil, fatty fish. And it's linked to a 6% lower risk of obesity-related cancers. Not only that, it's related to 13% lower cancer mortality overall. Straight up, that's just with one diet, and that is a Mediterranean diet. So, if I were to tell you what I would do, which diet I would do, would be the Mediterranean diet. Now, on top of that, one of the lifestyle choices that I would choose would be to fast. Fasting creates a process in our body called autophagy. Now, simplest way that I could explain autophagy is with a pack of wolves. And this is going to sound a little gruesome, but a pack of wolves. In good times, in good days, where there's abundant food, abundant supplies, wolves will multiply and multiply and multiply, no problem. But when times get scarce, what happens is the wolves will start cannibalizing themselves, basically the survival of the fittest, right? So our body is much the same. When we're in times of abundance, like we are, where food is plentiful, okay, we have no lack of food, no lack of any diet, right? Our body will just create cells and more cells and more cells and wonky cells and cells that are overabundant without regard. But when we fast, our body will cannibalize the weakest cells and only keep the strongest ones. So it'll actually cannibalize some of the dirtier, uglier cells that are causing havoc, that are mutating. So straight up, I would include fasting often into my life. Different foods I'd incorporate. I'd incorporate blueberries, avocados, apples, red grapes, kiwis, tomatoes. These are loaded with something called anthocyanins. These are loaded with other things called quercetin, lycopene. And these essentially are all phytochemicals that, according to science and research, may guard your DNA and reduce inflammation. Other things I'd add to my diet: walnuts, other things like yogurt for its probiotics, cruciferous vegetables, whole grains. Studies show that these few things specifically cause a reduction in colorectal cancer, especially in younger populations. So I would obviously do those. Again, berries, cruciferous vegetables, garlic, turmeric, nuts. These things are rich in immune supporting and anti-inflammatory compounds like allicin. So garlic is heavy in something called allicin and curcuminoids. These are useful in inhibiting tumor growth. And you heard none of those were processed foods. None of those were chips. None of those were cakes, cookies, pastas, you guys. Those are all whole foods. Some other things that I would do. Physical activity. You guys, did you know that 300 minutes per week of moderate to vigorous exercise can reduce cancer risk by up to 30% through hormonal, immune, and metabolic benefits? You guys, 30% reduction in all cancers just by exercising. That's crazy. So some other things I would do: healthy weight management, avoiding tobacco, avoiding excessive alcohol, minimizing ultra processed foods. These are foundational, you guys. If you go through any cancer program, right, the Gershon therapy or anything, they're going to put you on very little processed foods. It's going to be whole foods. Other things like broccoli and broccoli sprouts and Brussels sprouts. These contain something called sulforaphane. Sulforaphane helps reduce colorectal cancer, lung cancer, prostate cancers. I mean, all sorts of cancers. So those would kind of be, they say whole food lifestyle or whole food diet. Those are some of the things that I would include for sure, as a holistic pharmacist. Some of the natural compounds that I would take, which some people might deem as supplementation or nutrient therapy. Some of the big name natural compounds that I would take are things like curcumin or turmeric. Curcumin is known as an anti-inflammatory. It modulates what's called NF-κB pathway, which is basically a pathway for slowing tumors. Okay, so tumors grow through this pathway. It modulates it, which then slows it. Let's see, some other things that I would make sure 100 to get, okay, would be things like vitamin D. Okay, vitamin D is in dog, or the sunshine vitamin, the sunshine hormone, okay? The strongest human data for colorectal cancer risk reduction, that's a mouthful, is vitamin D, okay? It also supports immune modulation. So you want your blood levels to be between 50 and 100 is where we like it to be minimally, but 80 to 100, if your blood levels are between 80 and 100 of vitamin D, then you are probably never going to get cancer of any sort. It's just been shown to be right. So vitamin D would be huge on my list, okay? And in higher supplementation and higher IUs than the RDA would recommend, for sure. Black cumin seed or black cumin seed oil has another name for it in the holistic field, and that is that it's the cure for everything but death. So milk thistle is another one that I might be taking. Milk thistle or silymarin is one of the other names for it. It has protective effects in liver cancer. It's an antioxidant. It has detox support. Something else that I would be taking or implementing into my lifestyle, and that would be green tea. Now, I would personally take green tea extract. There's a compound in it called EGCG. It's a very potent antioxidant and anti-angiogenic. It's been studied in breast cancer and prostate cancer for the prevention, and it's leaning towards being an absolute powerhouse for those two cancers, which are ailing the majority of Americans. Something called sulforaphane. It's in broccoli sprouts, cruciferous vegetables, and things like Brussels sprouts. It's a good detox agent, and it has what's called epigenetic effects. Okay, and it has some emerging evidence for things like colorectal cancer and prostate cancer in the risk reduction. Better than treating cancer is to reduce it or reduce the risk of it, right? Medicinal mushrooms, I would say any kind of mushroom. You're looking at different mushrooms like maitake mushrooms. You're looking at shiitake mushrooms. You're looking at turkey tail. Let's highlight the fact that they offer beta-glucans. Okay, beta-glucans stimulate the immune system activity. Turkey tail, for example, has been studied alongside breast cancer treatment and has been highlighted to help the treatments target cancer better. So as a caveat to cancer, it would depend on which cancer I had and what specific things I might tweak to add or subtract depending on that. So, this is just a broad in general. If I had cancer, these are the things I would